Welcome to this quiz on the pressure volume loop. Pressure volume loop is a graphical representation of the pressure volume changes within the ventricle during cardiac cycle. So during the contraction, the pressure increase, and during the relaxation, the volume increase, and this is presented in that graph. So for pressure volume loop, we have this graph represent what change happened in the left ventricle, because if we look here at the pressure, we see the pressure here is more than 100 during systole, and we know that the pressure in the left ventricle is high, it reached to 120, but in the right ventricle will be much lower than this. So the only difference between the changes which occur in the cardiac cycle between right and left ventricle is the pressure changes. Pressure in the left ventricle will be high as compared with the right ventricle. So let's start our quiz here. So we have our first question on identify the cardiac cycle phase which corresponds to A to B. Okay, so let's look at the graph. What is A to B? So A to B is this one. So what we see here? We see here there is an increase in the pressure. There is an increase in the left ventricular pressure. There is no change in the volume. So volume is the same here, is the same point on the volume volume axis, but the pressure axis, we see there is an increase in the pressure. So that already tells you no change in volume means it's an isovolumetric phase. But is it contraction or is it relaxation? If the pressure is increasing, means the ventricle is contracting. So it's isovolumetric ventricular contraction phase. So A to B refer to isovolumetric ventricular contraction, where there is no change in ventricular volume, but there is an increase in the ventricular pressure. This phase, despite being very short in the duration in cardiac cycle, but it's very significant and important phase because of the increase in the pressure during that phase, because that increase in the pressure will be the reason to open aortic valve and ejection later on start. So this is our first question. Second question here, which phase corresponds to B to C? So let's look at B to C. So what happened in B to C? You can see here the volume is changing. We see here volume was in B was 130 and it goes to C, which is around 60 ml. So there is a decrease in volume. And the pressure is high. The pressure is high during that phase, but we see at the beginning of the phase, the pressure is higher as compared with the later part of the phase. So this phase while the ventricle is contracting and ejecting blood out into the aorta, so that causes the or corresponds to the ventricular ejection phase. So B to C is ventricular ejection phase, where the volume of the blood is coming out from the ventricle. So the ventricular volume, the blood in the ventricle, will be decreasing. So that is B to C is ventricular ejection. Then number 3 here is C to D. C to D. So in C, you have a high pressure going to low pressure. Okay, so this means the ventricular pressure is decreasing. Ventricular volume, no change. You see here, ventricular volume at the C point and the D point is the same. So it's an iso phase, isovolumetric phase, because there is no change in volume. But is it contraction or relaxation? We have a decrease in the pressure, means the ventricle is relaxing. So this is isovolumetric ventricular phase. Our last one is B to A. So D to A, we see here an increase in the ventricular volume. From 60 is going now to 130. Ventricular volume increase means that there is more blood coming into the ventricle, so that indicates ventricular filling. Okay, so in summary here we have the left ventricular pressure volume loop. We see here ventricular volume increase, that is filling phase. After filling, the ventricle contract isovolumetric, so there is an increase in pressure, no change in volume. Then the ventricle ejects the blood into aorta, so that is ventricular ejection. After ventricular ejection, the aortic valve closes, and aortic valve closed, mitral valve is already closed. That will cause relaxation. The ventricle starts to relax. No change in volume. No blood is coming in. No blood is going out. So there will be no change in volume, but the pressure decrease, and that we call it isovolumetric ventricular relaxation. Isovolumetric contraction, isovolumetric relaxation, ventricular filling, and ventricular ejection. Coming to the second question on this graph. What is the value of EDV, ESV, and SB? EDV stands for end diastolic volume. ESV, end systolic volume. SV, stroke volume. So what is end diastolic volume? So let's look at the graph here. Okay, so based on that graph, we need to state the value of each of these volumes. End diastolic volume is the volume of blood in the ventricle at the end of diastole. So where is the diastole? Diastole was here during filling. So that is the end of it. That is the end of diastole. So how much blood was there in the ventricle? 130 ml. So that 130 ml is the answer for EDV. ESV. ESV stands for end systolic volume. So where is the systole? The systole is here, the ejection. Ejection happened here. The ventricle already pumped some of the blood out, okay, and there will be remaining volume, whatever left after contraction, whatever blood left after contraction within the ventricle, we call it end systolic volume. So this end systolic volume, this one, at this point. So at this point, what volume we have? We have around 60 ml. So this will be the end systolic volume. So stroke volume. What is the stroke volume? Is the difference between EDV and ESV. The volume of blood that the ventricle pump out with each beat. We call it stroke volume. So this volume is calculated based on that formula in the diastolic minus in systolic volume. So it's a 70 ml. So 70 ml, that is the volume of the blood that is pumped out from the ventricle during ejection. And the systolic volume is the volume of blood that is left in the ventricle after ejection. And in diastolic volume is the volume of blood that that is present in the ventricle at the end of the diastole. Okay, coming to our question number 3. So question number 3 here is asking you 4 points A to D, means A, B, C, D. State the point at which aortic valve opens. Aortic valve closes, mitral valve closes. Okay, so aortic valve open. Aortic valve open to ejection to start. So when that happen in that loop. Okay, so ejection happen here during this phase. So aortic valve open here. So at point B, aortic valve open. Okay, for ejection to start. Aortic valve closed. Once ejection finish, aortic valve closed, so no blood comes back to the ventricle. Okay, so after ejection, aortic valve has to close. So when that happens, ejection in the here at point C. So aortic valve closes at C. So this means, students, during ejection only, we have aortic valve open. During the rest of the cycle, aortic valve will be closed. Aortic valve only open during ejection phase. Okay, so coming to our mitral valve. Mitral valve, that is the valve which is present between the atrium and ventricle. So between the atrium and ventricle on the left side, we have here the mitral valve. So this mitral valve open when we have diastole, we have filling. Okay, once the filling ends, so this valve will close. So let's look at the graph here. Where is filling? Filling is happening during that phase. That is ventricular filling. So mitral valve will be opening here. Okay, filling happen. Volume increase and also pressure increase in the ventricle. You see here the pressure in the ventricle is at the end of diastole is getting a high. Okay, higher than atrial pressure, and that will causes the mitral valve to close. So mitral valve closes here at this point, and this is very important to prevent backflow of blood from ventricle to atrium. So mitral valve closes at point A. Coming to question number 4. So question number 4 is asking about during which segment S1 is heard. What is S1? S1 is the first heart sound. So first heart sound is caused by closure of the mitral and tricuspid valve. So the closure of atrioventricular valves causes first heart sound to be here. So based on that, we need to know at which segment of this loop the first heart sound, which is caused by closure of mitral and tricuspid valve, will be here. So let's look at mitral valve. Just now I mentioned mitral valve is closing here. So that causes the sound to be heard during this phase, which is isovolumetric contraction phase. Okay, just a quick addition here that we have two heart sounds normally here, the first and the second. First heart sound is heard during isovolumetric contraction phase. S1 is heard during that phase, and S2 is heard during isovolumetric ventricular relaxation phase. S1 is heard because of the sudden closure of AV valves, and S2 is heard because of the sudden closure of semilunar valves. Okay, coming to question number 5. Question number 5 here is an application of your understanding of this pressure volume loop, and see how this pressure volume loop change with different conditions. Okay, so I have picked two conditions here, aortic stenosis and mitral stenosis, to see how the pressure volume change. So A, B, C represent left ventricular pressure volume loops seen in different conditions. That is A, B, and C. As you see here, you see the red color one. This pink color is referred to the disease condition or the condition which is not normal. And this one is the normal graph. So you see for each loop, you see this is a diseased one, this is a normal. This is a disease, this is a normal. So we need to pick which of these loops will be seen in condition of aortic stenosis. aortic stenosis. So what is aortic stenosis? So if we look at the heart again, so in the heart we have on the left side of the heart, we have the aortic valve here. So aortic stenosis means the aortic valve does not open completely. There is difficulty for the valve to open. In that case, the ventricular pressure has to increase higher than normal to open this valve, because the ventricle has to work harder than normal to open the aortic valve, because the aortic valve is not opening smoothly. Okay, so that means the significant feature that will be seen in aortic stenosis is the increase in ventricular pressure, increase in left ventricular pressure. So if we look at A, B, C, which one we can see that feature? We see it here in C. So here in C, you see there is a significant increase in the left ventricular pressure at the end of diastole. It has to increase too much to overcome the resistance and open aortic valve. That is one important feature. Another feature that helps us to pick this loop as a correct loop for aortic stenosis is the fact about stroke volume. So if we look at the stroke volume, we see here, this is the stroke volume in case of aortic stenosis as compared with this stroke volume in a normal person. So we see there is a decrease in the volume that is pumped by the heart because of aortic stenosis. Of course, because there is high resistance, there is an increase in afterload, and increase in afterload decrease stroke volume. So that is the reason why option C is the correct option for aortic stenosis. Coming to number two. Number two here, now our B, is which of these loops represent mitral stenosis. Okay, so in mitral stenosis, what we have problem in the AV valve. So on the left side again, you have valve between left atrium and left ventricle. So this valve is stenotic. Stenotic means it doesn't open sufficiently for blood to come into the ventricle. So this means there will be reduction in the ventricular volume at the end of diastole. There is impairment of ventricular filling. So the volume, so I have to look at the volume here. Where is the low in the diastolic volume? So if we look, we see here in A, we see here that is the volume of this patient as compared with the normal one. So here is 100 in the diastolic volume, but you see here is around 130 ml. So this means there is a reduction in the diastolic volume because of mitral stenosis. Of course, with mitral stenosis also, we see the stroke volume is low. So as compared with the normal one. So normal stroke volume will be bigger than the stroke volume in the condition of mitral stenosis. The reason here is because of reduction in preload. Okay, so preload, decrease in the volume of the ventricle of blood in the ventricle before contraction, that will cause decrease in stroke volume. Okay, so the decrease in preload causes the decrease in stroke volume in this condition. I hope you benefited from this quiz and you find it useful. in improving your understanding of the pressure volume loop and how it is related to the different phases of the cardiac cycle. We are going to have a cardiovascular physiology MCQ-based revision, which is coming soon. So if you have any questions related to cardiovascular physiology, you add it to the comments so we can include in our revision. Thank you, and I wish you all the best.